I'm Dr. JimBob Faulk with the Surgical Clinic. I went to undergrad at LSU in Baton Rouge. I then did my medical school at LSU in New Orleans, and then came way up north to Middle Tennessee to go to Vanderbilt for my residency and fellowship. Well, yeah, I get asked a lot, how did you choose vascular surgery? And I think surgery chooses you. I don't think you really make the decision. I don't think you really know that you've made the right decision until you've been doing it for a few years. This is an example, a little cartoon of what I use to explain to some of my patients. This kind of represents the arch of the aorta. This is an aneurysm, and this is a graft that we put in. This used to require an operation that I frequently refer to, we still do it, but I frequently refer to it as the largest operation any human can have, and it's really almost taken this into an outpatient procedure. We're able to put these in through small incisions in the groin as opposed to large gargantuan size incisions that we used to make to do this. Well, you know, one of the things I like about surgery and vascular surgery in general is that you always see something new that you haven't seen before. You'd think, you know, after years and years of training, going into practice, that eventually you would have seen everything, but there's always something new. I've been married for 15 years. I have 3 great kids, 11, 9, and 6, and they are the center of everything. I met my wife actually in high school. We got married right before I started medical school, and been a journey ever since. I have a very unusual hobby that none of my partners understand, off-roading in big Jeeps, climbing rocks, going through mud, things like that. We do that in conjunction with camping. Whole family comes. Yeah, I mean, I've gone from knowing very little about Jeeps and automotive type stuff to you know, having done now my own engine swap, built my own axles, built my own 1-ton Jeep. You know, a lot of friends that have coached me along the way, but you know, completely different avenue from what we do in our day-to-day life here at the hospital.